So what happens? The first thing is a cat comes in vomiting. Okay. The first thing I do is I grab the head, tilt it back, lower down, and I do this in my exams because cats can get cancer underneath the tongue. You always got to look under the tongue. And I lift up the tongue, and oh my God, there is this thing under the tongue. So at that point, what you do is either you anesthetize the cat, mask it down for brief anesthesia, cut it if it's not been going on too long,
Yeah.
and the x-rays, don't look horrible, and see what happens. So, and believe it or not, there are needles that have gone from this end out the back
Oh.
end without causing problem. Unfortunately, healthcare in this country for humans is not the way it used to be. I think medicine is broken. I think we as veterinarians do a much better job. But unfortunately, pet insurance, which is very well accepted in Great Britain, for some reason people here don't buy into it. And as a result of that, they're very concerned and they get crazy when a veterinarian says this procedure is going to cost so much. And they say, what? How could you charge that much? And somebody could say, when you go and have an ultrasound or MRI or even an X-ray, and you look at what your health insurance gets charged and what the hospital actually gets paid, it's 5 to 10 times what a veterinarian charges.
Insane. Yeah.
And people have a problem with that. And it's a very unfortunate situation because people get pets whether they can afford them or not.
Mm-hmm.
They get them for free from the shelter, possibly. They can afford to buy the food. The pet comes having been spayed or neutered and hopefully vaccinated. And then the owners figure, I'm done,
Yeah,
but they're
that's
not
right.
done. It's just the
Easy
beginning
peasy.
of a long journey.
Janet, I think we need to ask Dr. Linda our favorite question. I'll let
Uh-oh.
you
Yes.
ask her.
Dr. Linda, what is your pet peeve
Or human peeve.
or human peeve? It can be about pets or humans, whatever.
Yeah.
Friend
We always
peeve,
ask people that at
enemy
the end of the
peeve.
show.
Well, I think my peeve is with human medicine. Okay.
Oh.
If I'm allowed to say that. Okay. So, first of all, I'm Jewish. And one of the things that I did for all of my patients who passed was I planted a tree in Israel, which is something that a lot of Jewish people do in memory of somebody who dies. One of the first people for whom I planted a tree was Christian, and she came in crying. I'm going to get upset, hugging me, saying nobody has ever done a nicer thing in her life because I had a living memorial for her cat.
Mm-hmm.
When my husband died and he had malignant melanoma, did I hear from one of his team, from the oncologist? From nobody. We veterinarians give so much compassion and love and emotion to our clients and their pets that are members of their household. And whether we get, and I don't think they teach grief management or support in vet school to this day, that takes so much out of us. And I think that human medicine, because of insurance and the way it's got to be a 10-minute appointment, 15-minute appointment, and do this, that, and the other thing so we make more money, even though clients think we do the same thing. They just don't allow themselves the compassion and caring that we provide our
Mm-hmm.
owners and pets.
Actually, my really good friend has a master's in social work and was hired by the Cornell School. It's their veterinary medical clinic. It's an emergency clinic in Stamford, Connecticut, and she is the consultant for clients who are grieving or have been told their pets are ill. And it is the perfect job for Catherine because she's a dog lover. She has a Westie, and I just thought that was a really neat thing. It's the first time they've ever hired someone that has experience with humans and grieving.
Well, there's an 87-year-old lady that attends a grief group that I'm part of who had to put down her very old golden. She moved to a place that her husband could be in one thing because of his medical problems. She was in an independent living thing, and then he died. She had to get rid of the dog. She had to move from, her house that she loved, all these things she loved that she lost, and then she lost this dog. Each time at the grief group, she talks about needing a replacement dog. She wants to get a 9-year-old dog. She was supposed to get this dog, but I think they looked at how old she was and they decided, no way. And she's just beside herself because she so desperately needs a dog to be part of her life.
Yeah.
And I don't know that the rest of the world who never had animals appreciate how important pets are
Yeah.
in people's lives, to keep them going, to give them a reason to get up in the morning, to go outside if you have a dog, to walk the dog. I mean,
So true.
veterinarians are so underappreciated for all of the life skills that we possess and that their pets give to them.
And for our heart. I think that's why veterinarians now have the highest suicide rate in this country, because it's such an emotional profession. You're in one room with a client and a dog that you've been seeing for 15 years, and it's at the end of its life. And now, what's my next appointment? A new puppy that's jumping and happy. I've got to go from being so sad to being so happy in that next room, because that puppy person doesn't want to hear what I just went through in that.
Right.
So it's turn on, turn off, turn on.
Right.
And it's got to hit you eventually.
Right.
And it does.
And I mean, every time we end up euthanizing a cat, owners are crying, we're hugging one another. You would never see that in human medicine.
You don't.
No.
And I will tell you real quick before we go, when my father passed away, I was with him in the room in the hospital, and I would be sitting there, I'd fall asleep in the chair, and he passed away, and I called the nurse's station and I said, you might want to come down here. I think my dad just passed. And cleaning lady, who always came in and just never said anything, kept her head down and, just kind of gave me a little smile. She came in and hugged me. And the nurse on duty said, well, he was fine when I came on my shift. So, and you know what? Isn't that something that your father dies and those are the two things you remember? And that African-American cleaning woman just took me in her arms and hugged me. And I'll never forget that nurse's comment. I thought, what a heartless thing to say.
Right.
But that's why I'm so proud of our profession, because that would have never come out of anyone's mouth that I know in our profession. And I think that's why our profession is so tight. Look, I can call on Linda to come and talk today for an hour. I can call on, the dean at the vet school who's going to be on. And we're just a tight group. And my brother-in-law is a human ER doctor. I don't see any of that camaraderie in that profession with him, ever.